بسم الله الرحمن الرحيم
بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي واحلل عقدة من لساني يفقهوا قولي رب زدني علما. I'm Dr. Qasim. I'm a senior manager new products, and along with me is Dr. Saad. We welcome you to the product pocket info guide training. Today we will discuss the Ceclor-MR pocket info. Ceclor-MR contains Cefaclor tablet 375 mg. It belongs to a therapeutic class second generation cephalosporin. Mode of action: Ceclor-MR act by attaching to the specific penicillin binding protein, which are mostly transpeptidase that serve as a drug receptor on bacteria. Inhibition of cell wall synthesis by blocking transpeptidation of peptidoglycan. Activation of autolytic enzyme in the cell wall, which result in the lesion that cause bacterial death. Now come to the indications of Ceclor-MR. Upper respiratory tract infection, sinusitis. This is the inflammation. It means that inflammation of sinus. Pharyngitis and tonsillitis. It is the inflammation of pharynx and tonsils. And otitis media. It is the inflammation of the middle part of the ear. Lower respiratory tract infection, acute bronchitis. Acute bronchitis means the inflammation of bronchi. It's also known as chest cold, and it is a short-term inflammation of bronchi. And the pneumonia. Pneumonia is inflammation of lungs, basically the air sacs. Acute exacerbation of chronic bronchitis. It is a sudden worsening of chronic obstructive pulmonary diseases symptoms, that is shortening of breath and quantity and color of phlegm, that typically lasts for several days. Urinary tract infection, uncomplicated lower urinary tract infection, that is cystitis. Cystitis is the inflammation of urinary bladder that's most commonly in women. And asymptomatic bacteriuria. It means that infection or bacteria in the urine, and that is asymptomatic. Means the patient is symptomless without any symptoms. Skin and skin structure infections. Now come to the dosage for adult, including elderly, pharyngitis, bronchitis, tonsillitis, and lower urinary tract infection, skin and skin structure infection, Ceclor-MR 375 mg tablet twice daily. For pneumonia and sinusitis, 750 mg or 2 Ceclor-MR tablet twice daily. Now come to the bioavailability. Bioavailability is the fraction of dose of the drug that is absorbed from its site of administration and reaches in an unchanged form in the systemic circulation. Ceclor-MR is well absorbed and independent of food intake. Metabolism 15 to 40%. Half-life is the amount of required drug for quantity to fall to half its value as measured at the beginning of the time period. It's 0.6 to 0.9 hours, that is 36 to 54 minutes. Excretion through renal through kidneys. Unique selling points: Ceclor is stable against beta-lactamase. Beta-lactamase are the enzyme produced by some bacteria that provides resistance to beta-lactam antibiotic like penicillin. Ceclor has high tissue penetration. Ceclor has better absorption and GI tolerability. Tolerability refers to the degree to which adverse effect of the drug can be tolerated by the patient. Ceclor-MR has high clinical efficacy or success, that is 99% pharyngitis and in tonsillitis. Ceclor-MR has high efficacy, that is 94% in bronchitis and 94% in AECB, that is acute exacerbation of chronic bronchitis. Ceclor provides high clinical efficacy in 95% pneumonia, 93% acute sinusitis, and 97% urinary tract infection. In pharyngitis and tonsillitis, Ceclor has 97% clinical cure rate and 97% bacteriological cure rate. Ceclor has high clinical success in lower RTI, that is of 97%, as compared to cefixime, that is 94%, and as compared to amoxicillin clavulanate, that is augmentin, 79%. Ceclor belongs to the pregnancy category B. It should be used during pregnancy only if needed. For lactation, caution should be exercised. The competitors of Cefaclor are Cefalor from Bosch, Cevalor of Barrett Hodgson, Safeguard from Stanfarm, Slate from Sami, and Hyclor from Hilton. Thank you.